Do you do mummy makeovers?
Yeah. Do we do anything else?
But we stopped for a while.
We did stop for a while. But
We were limited.
The stopping for a while, I'm going to put it out there, it was a little bit post-COVID.
Oh.
And the hospitals that we worked with were anxious, I think, about quite long procedures that were considered to be more lifestyle than functional. Okay,
Fair enough.
Which is fair enough.
Absolutely.
And you can fill loads of operating lists with them, and there were huge healthcare demands, so I get it. If you look at the strictly evidence-based health implications of longer surgery, what does the data tell us? And actually, surgery lasting up to about 5.5 hours is fine in terms of DVT risk. After that, the complication profile does start to increase, and at that point I really do have to start to have a really serious conversation about whether you really do want to do this in one stage or whether you do want to do it in 2 stages, and this is what a DVT, deep venous thrombosis, actually means and looks like, and the implications and so on. So up to about 5.5 hours is where I like to cap things. Now, you can get a lot done in 5.5. You can get a lot done. There was a recent patient. Has that post gone out? Oh, of course it has, yeah. So the post has gone out. And the lady on our Instagram grid, one recent, did want all her surgery done in one go, tummy and breast. And I normally say if it's a small breast operation and a small tummy operation, smallish, do one in 2.5 hours, do the other one in 2.5 hours, then it's a 5-hour operation and you're fine. But hers both were a bit longer than 3-hour operations. It was a decent big old breast reduction and a big old tummy tuck. So my first response was, I can't. And she said, really, I've got one shot at doing all my surgery in one go, all my surgery, and I'd really like to get them both done. I said, okay, there is a way around this actually. And, I have friends who are plastic surgeons as well, believe it or not. And I can just invite one of them along, and one of them can do your breast operation and one of us can do your tummy operation. And said, okay, so we both worked simultaneously. We both got both done in about 3.5 kind of hours.
Yeah.
And that was it. And this is how she's looking, and she's just looking a bit stunning, actually. So that is a before and after of...
Oh, I was just going to do that one.
That's her as well.
Look at her, living her best life.
Living her absolute best life. So that is a 1-stage mummy makeover, tummy, breast, tummy tuck with liposuction and contouring, and breast, major breast reduction, done really safely, single stage, short operation. There you go. And these photos are what, 3 months later? I think they're 3 months on.
Yeah.
Yeah.
Yep. So the answer is yes, we do mummy makeover.
There is a solution.